Greetings to all. This is a documentary presented by Group 2 on the topic A Global Pandemic, the Story of Our Time. In late 2019, a mysterious virus emerged in Wuhan, China, spreading rapidly across the globe. COVID-19, a disease caused by the SARS-CoV-2 virus. From the front line of healthcare to the lockdowns that shuttered economies. This documentary explores the COVID-19 pandemic's origin and its far-reaching consequences and the global responses that has shaped our world.
So we discuss the impacts of COVID-19. First is health sector. COVID-19 put immense pressure on healthcare system, leading to overwhelmed hospitals, a surge in patient admissions and significant strain on medical staff. The second is economic impact. The pandemic triggered a global economic slowdown, causing recession, job losses and disruptions in various industries such as travel, hospitality and retail. Third one is social impact. Quarantine measures, lockdowns and social distancing altered social interactions and routines, leading to feelings of isolation and disrupted community life. Fourth one is education system. So schools and universities were forced to close or shift to remote learning, impacting students' educational experience and creating disparities in learning outcomes. Fifth one is global cooperation. The pandemic pushed countries to work together in unprecedented ways to research, vaccine development and distribution efforts. Sixth one is economic shifts. While many industries suffer, some like technology, e-commerce and healthcare, saw significant growth. This change accelerated digital transformation across sectors. Seventh one is environmental changes. The pandemic led to temporary decreases in pollution levels and emissions due to reduced industrial activity and transportation. However, this effect was short-lived and emissions returned as restrictions were lifted. Eighth one is global cooperation and tensions. The pandemic fostered international collaboration, vaccine development, and public health measures, but also created geopolitical tensions, particularly around vaccine distribution and global supply chain.
Effects of COVID-19. Long-term health issues. Survivors of severe COVID-19 cases reported ongoing symptoms such as fatigue, shortness of breath, and cognitive impairments, collectively known as long COVID. Economic shifts. Economic recovery varied greatly across sectors, with some like technology and online services thriving while others struggled to regain pre-pandemic levels. Changes in work culture. The rapid adoption of remote work changed workplace dynamics, lending to the normalization of hybrid work models and changes in productive measures. Increased public health awareness. The pandemic heightened awareness of public health practices, including the importance of vaccination, hygiene, and emergency preparedness. Healthcare innovations. The urgency of the pandemic drove rapid innovations in medical technology and vaccine research, including the development of mRNA vaccines. Changes in consumer behavior. People shift their buying habits, focusing more on essential goods, online shopping, and home-based activities, influencing business strategies and market trends. Altered social dynamics. Social norms changed with physical distancing, mask wearing, and limited gathering becoming common. These changes altered how people interest and perceive community spaces.
Advantages of COVID-19. Though COVID-19 brought significant disruption, it also offered unexpected advantages. The pause in human activities led to a noticeable reduction in air and water pollution. Wildlife returned to spaces they had long abandoned, and nature began to heal. In many ways, the pandemic accelerated digital transformation, e-commerce boomed, telemedical became more accepted, and remote work became viable, reshaping future workspace norms. People also became more health conscious, prioritizing hygiene, mental health, and well-being in ways that had previously been overheard.
The disadvantages were, of course, profound. Millions of lives were lost, and many who recovered faced long-term health effects. The global economy took a devastating hit, with small businesses in particular struggling to survive. Educational setbacks became prevalent as students, especially those in disadvantaged areas, struggled with online learning. Mental health issues surged due to the prolonged isolation, uncertainty, and financial strain. COVID-19 exacerbated existing inequalities, with the poorest and the most vulnerable often hit with the hardest. Other disadvantages included healthcare overload. Hospitals and healthcare providers were overburdened, leading to resource shortages and deferred treatments for non-COVID related health conditions. Economic disparities. Low-income workers and small businesses were hit hardest by job losses and financial instability, increasing economic inequality. Mental health crisis. Prolonged isolation, fear, and uncertainty caused spikes in mental health issues, including anxiety, depression, and stress. Educational interpretations. Beyond access to technology, the lack of in-person instruction led to diminished learning experience, particularly for younger children and those with special stimulus. Economic debt and strain. Government support measures such as stimulus packages and aid programs led to increased national debts that could have long-term economic implications. Education inequities. Students without access to reliable internet or learning devices face significant setbacks in their education, further educational inequality.
Challenges of COVID-19. Vaccine distribution and equity. Ensuring fair distribution of vaccines, especially to low-income countries, was a major challenge completing global recovery efforts. Public compliance and misinformation. Combating misinformation and ensuring public compliance with health measures were difficult, affecting the effectiveness of pandemic responses. New variants. The emergence of new, more contagious variants required ongoing adaptation of vaccines and health protocols. Sustainability of economic recovery. Governments face the challenge of balancing immediate recovery efforts with long-term economic stability and debt management. Misinformation and disinformation. The spread of false information about the virus, treatments, and vaccines complicated public health efforts and eroded trust in institutions. Sustainability of remote work. While remote work became normalized, challenges arose around maintaining productivity, team cohesion, and mental health over extended periods.
In conclusion, the COVID-19 pandemic had widespread impacts on health, economy, and society, revealing vulnerabilities and testing the economy of systems worldwide. Despite the disadvantages and challenges, the pandemic led to significant advancement in healthcare, technology, and spurred global collaboration. Moving forward, lessons learned from COVID-19 should inform future public health strategies, enhance preparedness, and guide equitable economic and social policies. Addressing the gaps exposed by the pandemic, such as healthcare access, economic inequality, and misinformation, will be essentially be building more resilient societies acceptable of facing future crises with greater utility and efficiency. The COVID-19 pandemic serves as a reminder of humanity's interconnectedness and vulnerabilities within our global systems. It has emphasized the importance of coordinated responses, adaptability, and investments in public health infrastructure. The crisis accelerated the trends in technology and reshaped the world economy, providing that the resilience and innovation can change from adversity. The pandemic's lessons underscoring the necessity of not only preparing for future health emergencies but also addressing long standing systems issues such as inequality and access to resources. The long term recovery from COVID 19 is as much about healthing, social, and economic wounds as it is about bolstering healthcare systems. The pandemic illuminated both the strengths and gaps in global response strategies and highlights the critical role of science, transparency, and global solidarity in overcoming a healthy crisis of this magnitude. Thank you.